As we were just discussing, COVID case numbers are on the rise, but it's as yet unclear whether the link between cases and serious illness and death has been broken or just weakened. One person who might be able to shed some light on this is the man who understands the data as well as anybody, the national statistician, Sir Ian Diamond, who joins us now. Sir Ian, you're the national stato in today's lexicon, and one of the measures that you keep an eye on is the prevalence of antibodies, whether they come into us by vaccination or by infection. But it's a sign of how close we are to this thing that people talk about, herd immunity. How do you think we're doing right now on that?
I have to say, Trevor, good morning. It's lovely to see you. I have to say that I think with regard to antibodies, we are doing very, very well. I'd have to say that antibodies aren't a perfect protection, but at the same time, we're saying very clearly that we think that about 9 in 10 people in England, in Wales and in Northern Ireland, about 8 in 10 in Scotland do have antibodies at the moment. And let's be fair, that's up from 2 in 10 in January. So I think that is an enormous increase. I have to say the group with the lowest at around about 60% is those aged 15 to 24. So clearly the vaccination program that the minister was just talking about remains incredibly important, but certainly we're making an enormous amount of progress, an absolutely admirable amount of progress.
OK, so we're moving along, though we've got some work to do with younger people. One of the issues where there's uncertainty is about the relationship between the average number of contacts that an infected person has and the likely probability of infection. Based on what we've seen previously, at the moment they're talking about 2 infections per infected person, as it were. Based on what we've seen before, how many contacts do you think each positive case is likely to be having in the next period?
I mean, Trevor, that's an incredibly, well, it's not just a difficult, it's almost an impossible question, because I don't need to talk to you about distributions, and I don't need to talk to you about the challenge of looking at it. I should also say that, it really does depend on the contact. Professor Kath Noakes at Leeds University has spoken eloquently about different types of contacts and how you could get a contact, but you'd be so unlucky just from walking past someone, as opposed to very close contact in a crowded space. So I just think the numbers don't talk about the context, and it would be wrong to answer that.
OK, but do you think that the Health Secretary's estimate, it's not an estimate, but his upper projection, if you like, of 100,000 infections a day, do you think that's credible?
Well, I think what we're seeing at the moment, and let me be clear, we are keeping an absolutely close minute-by-minute eye on the number of infections that we are seeing in our very, very large survey, which does give us some of the best data in the world, because let's remember many people who do get the virus are asymptomatic, and those data will continue to be incredibly important, and I thank everybody who takes part in them. What we are seeing is, yes, an increase. So our most recent data for England has at about 1 in 160 people. That's about 0.6%. Now that's going up quite quickly. Having said that, it's still slightly less than a third of where we were on the 2nd of January this year. Scotland is a bit higher, although the numbers of infections seem to be flattening a little in Scotland. So, look, Trevor, the numbers are going up. They're driven largely, I would have to say, by, at the moment, the big increases in the northeast. The northwest had big increases and is at the same levels as the northeast. There's a slight trend towards a flattening there, and things are very much lower, with the lowest levels in the east of England and the southeast of England. So at the moment, definitely an increase driven by, at the moment, largely the Northeast, and driven very much by people aged 18 to 24. We're seeing very, very little increase in people aged over 50, for example, and I think that's encouraging. So I'm not going to demur with projections into the future, but I'd have to say that projections into the future have very large confidence intervals associated with them.
But you don't rule out the possibility of 100,000 a day?
Well, I don't think, I think it would be wrong to completely rule it out, but I would have to say that at the moment we don't have the data either really to put a firm number on things. But we are seeing a steady and fast increase in the Northeast, steady increases elsewhere, as I say, low increases in the Southeast and the East of England.
Underlying the judgments that the government has to make, which are not your judgment, I understand that you're not in this field, but underlying it is a view about whether the link between infection and hospitalisation and serious disease and death has truly been broken. Now, you know, in the stats world, we'd be talking about random relationships and all of that. But, you know, in simple terms, where do you stand on this? Do you think that link has effectively been broken or not?
Well, I'm in the severely weakened school for the very simple reason that we need to continue tirelessly to look at the data, and we are at the, if you like, the beginning at the moment of looking at this, and all the evidence, as the vaccine minister just said to you, is that we have a younger cohort of people being hospitalized at the moment, and while hospitalizations are going up, they are now a long way from some of the levels we have seen before. And so I'm very hopeful that we have really made a strong break, but at the same time, I would have to say at the moment, all the evidence allows me to say severely weakened.
Taking all of this together, and I want to ask you about a particular event as a sort of example of judgment that has to be made. Next month, Manchester United play Leeds, first game of the season, 14th of August. 75,000 people at Old Trafford. Now, were you to be offered a ticket for that game, would you be going along to spend the afternoon? 75,000 people, most of whom would not be wearing masks, given the levels of compliance. What would you advise?
Well, Trevor, I spent a long time, first of all, if it was you who was offering me the ticket, trying to swap it for one at Torquay United. But having said that, a couple of points you made. You know, why is it that you say that not many people would be wearing masks? We are seeing from our data, our opinions and lifestyle survey, that the great majority of people are saying they would continue to wear masks in crowded places. Were I to be going, I would be wearing a mask. So, I mean, I think we have to think very carefully about making those kind of assumptions. And I do think that again, people will be making decisions on the basis of what they see the risk at that time, and I'm sure the great majority of people would be looking at both that risk and what the risks were before taking the final decision.
Okay, so Ian, you're probably the most statistically literate guest that we've ever had on this programme. Statistically speaking, what's going to happen tonight?
Oh, well, look, I've been saying to anyone who will ask, 1-1 after extra time, and we will win on penalties.
Penalties? Oh, okay.
Football is coming home, Trevor.
You've actually anticipated my question. Thank you. So England win on penalties?
No question.
You heard it here first. Sir Ian, thank you very much indeed.